So we have over 20 asymptomatic cases, and 16 are cases from the employees of the Kaiyang Seafood Company, and also 2 close contacts of the employees and the close contacts of the confirmed cases and asymptomatic cases. And second, I would like to brief you on the situation about the nucleic acid test. The National Health Commission have sent a delegation to facilitate with the nucleic acid test in Dalian. And at the same time, we are also improving the quality and the testing capabilities of Dalian medical institutions. We are focusing on the quality of the testing. We encourage the local residents to make appointments to receive the nucleic acid test, and these people can check the testing results from the State Council application and the local applications. So all the medical institutions, they have been mobilizing all resources to help to conduct the nucleic acid test. And right now we have completed the majority of the residents to complete the nucleic acid test. And also we are completing all the nucleic acid tests for residents who are living in the Dalian 1 streets. And recently we are conducting the 3rd round of the nucleic acid test to people who are living in the Dalian 1 streets. And yesterday we have completed the NAT for over 839,000 people. We also conducted the street measurements and the control measures to people who are close contacts of the employees from Kaiyang Seafood Company. We're establishing a list to make sure that we can screen all the possible suspected cases. We're making sure that we understand the history of the travel for all of these people so that we can plug the loophole of the epidemic and cut off all the transmission routes. For all the close contacts of employees from Kaiyang Seafood Company, these people will be receiving isolation, and also they will be receiving 3 rounds of nucleic acid test. At the same time, we are making sure that we will conduct a strict measurements to the 4 types of people, including the confirmed cases, suspected cases, fever patients, and the close contacts. Also, we have to track down the travel history to all these 4 types of people. For the confirmed cases and the asymptomatic cases, we will conduct the epidemiological investigation to these people. If they develop symptoms, we will bring these people into centralized quarantine. When necessary, we will send these people to the number 6 People's Hospital in Dalian for treatment. And also we will impose lockdown to certain districts. For example, for buildings where we identified confirmed cases, we will check down on the close contacts of these people, and also we will lock all the relevant residential buildings. And for different districts and the communities, we will strengthen our accountability to managing all of those districts. Especially for people who are staying at home for isolation, we have to monitor their health conditions. And also we will have working staff to screen out all the asymptomatic cases for those buildings and community residential areas. We will classify different districts with different level of risks. For high-risk regions, we will extend our scope of the prevention and control work. On a daily basis, we will conduct disinfection to those public facilities. We will increase our frequency of disinfection to all of these residential areas. At the same time, we also offer services to people who are living in those communities who are under lockdown. Third, we will also conduct the epidemiological investigation in due course. For places who have been used as the centralized quarantine center, we will separate these places into different sections so that we can manage the risk of the transmission of the virus. At the same time, we will also pay attention to the safety for the utility electricity for those places, and we will also help to screen out the possible cases that occurred in those areas. We also establish an accountability list to managing all of those public places. Fourth, we will also focusing on the food safety issues in those regions, focusing on the whole production chain, including the purchasing, supply chain, and other areas. We will screen out all the possible risks for the food safety. Third, for public places who have been used for the centralized quarantine site, we will also strengthen our work in the public security. We are making sure that we have a safe environment for these places. Fourth, we will show humanitarian care to people who have been staying in those centralized quarantine places and those who are receiving the isolation in those places. So we will provide psychological counseling to all of these people who have been staying at the centralized quarantine site. We will also establish a task force to provide counseling to all of those patients who have been staying in those places. We will make sure that these people will not go to extremes when they're undergoing the quarantine. Right now, Dalian City is still at a severe stage for the epidemic prevention and control. We have to remain vigilant and cooperate and respond to the requirement of the epidemic prevention and control, making sure that unless necessary, please do not leave Dalian City. Make sure that we wash our hands frequently. We do not gather and do not share our meals with others. Make sure that you do not eat raw food and do a good job in protecting yourself so that we can cut off the transmission route of the virus. So that is my update. Thank you. Now I would like to give the floor to Director Tang Yi to brief us on the situation of the epidemic prevention and control in communities. Friends from the media, good morning. Since the outbreak occurred on July the 22nd in Dalian, with the strong leadership and guidance of the National Health Commission and the leadership of the municipal government and the provincial government, different districts in Dalian City has acted swiftly. They have given a key role of the communities in fighting against the virus. All of the Dalian residents have been staying united to fight against the virus. All the working staff in the communities have been dedicated themselves in fighting against the coronavirus. Now we have made major progress in this regard. Now, I would like to brief you on some of the epidemic prevention and control work relating to key regions, key districts, and key population group. First, we have taken strict measures on the lockdown. After Dalian City identified the first confirmed cases, we have abide by the strategy of preventing imported infection and domestic resurgence. To meet in high-risk regions, we have imposed lockdown. We also impose 5 strict measures and strengthen our efforts in mass prevention and control mechanism. Also, we assign responsibilities to different communities and residential areas. And the people from all aspects have been supporting the communities to prevent and control the virus. And these people have been working on a 24/7 basis. For 16 blocks under Dalian 1 street, we have locked 7 blocks. And also all of these people, they have to present a pass in order to enter into the Dalian 1 street. And also we are setting up control points in different highways. In the lockdown areas, the residents are not allowed to go out and they have to implement the prevention and control measures. In Pingfang district of Dalian 1 street, they also adjust their prevention and control measures. And all of the prevention and control work will be conducted by different units of the Dalian 1 street. For each one of the units, we only set up one exit point. By doing that, we can conduct targeted management. And also, we will provide daily necessities to all the residents who are living in the Dalian 1 street. And also, we are conducting a thorough disinfection to the public toilets in the Dalian 1 street. We are also encouraging the community cadres to conduct disinfection to those public facilities. Especially, they have to focusing on the door handles for those public toilets. Right now, the municipal government and the provincial government, they are also sending out a task force working together with the National Health Commission, and they're going on site for the medium and high-risk regions to check the condition in the medium and high-risk regions. They also provided guidance on the disinfection to all of those areas, especially for communities where we found confirmed cases. For different buildings, we also imposed the lockdown, and all of these residents have to stay in their homes for isolation. On August the 1st, we have formed 7 supervision groups that led by the provincial government. And these people will provide 24/7 guidance to people who are living in the Dalian 1 street. By doing that, it can enhance the awareness for the local residents for the epidemic prevention and control. At the same time, they also provided guidance on the disinfection. As of August the 3rd, we have closed off 24 communities and 80 residential communities. 75 in Ganjin district, 4 in Jinpu Xinqu. And right now, for all the community residential areas, they're in good order. And also, the close-off management is achieving an effective effect. And second, we will make all our efforts to provide services to all the residents who are living in those close-off communities. The municipal government and the provincial government attach great importance to the needs of people who are living in the Dalian 1 street. We will provide support in terms of utility supply, electricity supply. By doing all of that, we can ensure that the daily life can be guaranteed for all of those residents. Also, we are working with the Psychological Association of Dalian Municipal Government. We have recorded a series of videos to provide psychological counseling to people who are living in the Dalian 1 street. By doing that, we can alleviate their pressures during their isolation period. And also, we are formulating a working plan to ensure sufficient supply to all of those people. We are also organizing a group of volunteers who can provide support to people who have been under lockdown in the Dalian 1 street. A variety of services have been provided to those people. In Ganjin district, the service team has been working together with the public security team. They are providing customized services to the residents. And for the Ganjin district, they're also applying a grid-style management. So the service can cover over 70 square kilometers. We are organizing 72 service points. So for these 72 service points, they will provide the daily necessities to residents who have been living in the Dalian 1 district. We are also combining the online and offline services to ensure that the daily necessities can be delivered to the residents who are under lockdown. We are working with 12 online companies and over 20 offline companies, and over 100 teams have been providing services to people who are living in the Dalian 1 district. For the Jinpujing district, they are also compiling a list of residents who are living in their districts, and they establish a WeChat group to understand the needs of the residents. They are providing food supply and also services to people who are living in those areas. For Jingang district, we also have grid management. They are working together with the officials to understand the needs of the people who are living in those areas and help them to make daily purchase and also deliver medicines to those people who are living in those areas. And for people who are with underlying disease, we will also provide point-to-point services and also arrange ambulance to transport some of the underlying patients to the hospital. Fourth, we will provide special care to special groups. Right now, in some of our lockdown communities, we have vulnerable groups, including the elderly people, pregnant women, and the people with disability. We have compiled a list for all the 380,000 vulnerable groups. And for some of people, they have been living alone, so we always attach great importance to this group of people. We will provide guidance to different communities so that they can provide customer services to each one of those personnel who are under difficulties. We're also establishing a 24/7 service channel to understand the needs of those people, especially people who are living by their own. So we will prioritize their needs and try our best to fulfill their needs. At present, we still have a group of people who are living in the medium and high-risk regions. We have provided services to these people for over 1,000 times. For key groups of people, we will provide daily necessities for free. By doing that, we can ensure the daily livelihood of all of these people. By taking this opportunity, I would like to extend my heartfelt appreciation to all the volunteers and residents who have been dedicating themselves in fighting against coronavirus. In key areas, we have 2,500 volunteers who are participating in the epidemic prevention and control work in the front line of the communities. Their sacrifice and contribution demonstrate the spirit of Dalian residents. And also, I would like to extend my appreciation to the community cadres. They have been working really hard in this period, and also they shoulder carry responsibilities. For some of these cadres, they have been working tirelessly for 2 weeks, and each day they can only rest for 2 to 3 hours, and sometimes they have to work overnight. So by taking these opportunities, I would like to extend my appreciation and show my highest respect to all of these frontline cadres. Going forward, we will implement and exercise the deployment from the municipal government and the provincial government. So we will fulfill the needs for the 4 early measures and the 4 party responsibility. We will analyze the current situation in Dalian and take strict measures in implementing all of the prevention and control work. Make sure that we can do a good job and build a network to fight against the coronavirus and make our due contribution in this fight against COVID-19. That is my introduction. Thank you. Now I would like to give the floor to Mr. Luan Yuxuan to brief us on the situation about the epidemic prevention and control in the rural areas. Friends from the media, good morning. I would like to brief you on the guidance made by the Dalian Epidemic Prevention and Control Task Force, and especially our prevention and control work in the rural areas. After we received the instruction from the Dalian Epidemic Prevention and Control Task Force, we immediately started our work in the rural areas. We will clarify the responsibilities in different sectors. We are working on areas to make sure that no virus enter into the villages, and we also have to ensure food safety in the rural areas. We also improve our allocation system in the rural areas and supervise the work in the rural areas. Once we identify a problem, we will make corrections immediately. We clarify the responsibility for all the working staff. And also we are responding to the requirements of the 4 early measures. We give full play to the CPC Party Committee in the Dalian city, make sure that we have sufficient personnel and supplies in the rural areas. We also encourage all the rural villages and the residents to cooperate with the municipal government to make sure that no virus enter into the villages. We have to make all our efforts to make sure that we can implement all the prevention and control work. Second, for the rural department of the municipal government, we publish a notification to clarify the responsibilities for the rural areas in Dalian City and conduct the grid-style management. We also give full power to the senior officials for the rural organizations, including the party officials and women representatives, and we are doing what we can to screen out all the possible asymptomatic cases. If some people develop symptoms, we are making sure that these people will stay at home. And if we identify some cases, we will report it to the municipal government by no time. And also we are providing the guidance on the animal epidemic prevention and control. Among 876 villages in Dalian City, we have mobilized over 20,000 cadres to dedicate themselves into the fight against COVID-19. We also have put stock of 1.9 million facial masks, and we have also prepared over 200,000 protective suits. When we are preventing and controlling the epidemic, and also we are attaching great importance in the animal epidemic prevention and control, we are organizing a special task force to provide supervision on the animal epidemic prevention and control. And for 57 husbandry centers, we are also checking down the situation of the poultry and animals raised in those regions. We are also strengthening our work in screening possible virus in the fishing ports. We are responding to the guidance made by General Secretary Xi Jinping and do our best to improve the environment in the rural areas. We are also organizing over 400,000 trucks to clear daily garbages in the rural areas to make sure that all the disposal waste can be handled in a proper way. Third, we will strengthen our work in the agricultural production to ensure supplies in Dalian City. When doing a good job in the epidemic prevention and control, the municipal government also attached great importance on the agricultural production. The municipal government also published a notification on ensuring agricultural production in Dalian City. And also we also need to pay attention to the development of the husbandry in the rural areas. We will strengthen our efforts in the mobilization and allocation of the vegetables and the agricultural products. We are setting up control points in different agricultural fields that we can make sure that all the fruits and vegetables can be transported into the city. And also we are conducting supervision sites to make sure that the quality of the vegetables and food can be guaranteed. And also we have to make sure that all of these vegetables are non-pollutant and insect-free. And at the same time, we also have to monitor the weather condition and to prevent the impact of the natural disaster. We have to make sure that the quality of the meat, eggs, and the milks are up to standard. According to our analysis, we need to provide over 40,000 tons of vegetables and over 20,000 meat to the Dalian cities. And we are fully capable to provide all of those supplies to Dalian City. And also we have to organize NAT to certain groups of people to make sure that we can reduce the risk to the minimum level. And we have to encourage the public to wash their hands frequently and wear a facial mask on a daily basis. So by doing all of that, we can reduce the risk of the cross-infection. And for farmers who are working on the field, we are also providing trainings to those people to make sure that they stay safe when they're working on the field. In key business and the key sectors, the municipal government and the rural departments also publish a guidance. Going forward, we have to respond to the requirements from the municipal party committee and the municipal government. We have to make sure that all the measures can be implemented. We have to ensure that we can provide sufficient supply to the cities and stabilize the price in the market. Thank you. Thank you for Mr. Luan's introduction. Now I would like to give the floor to Mr. Wang Wei. Friends from the media, good morning. Since the outbreak of the epidemic occurred on July the 22nd, the Public Security Bureau have been responding to the requirement of the municipal government. We have been working closely with the National Health Commission in facilitating the nucleic acid test. At the same time, we are also ensuring the public security in Dalian City. First, in key regions in Dalian City, in view of the different level of risks in different regions, we are allocating our resources to making sure that the environment is safe for all of those regions. In medium and the high-risk regions, we are making sure that there's no other population that coming in and out from the communities. We are working with the party secretary and conduct regular patrol in those regions. On one hand, we establish a ledger on people who are living inside of the lockdown areas. We are checking down on the health conditions for people who are staying for home isolation. At the same time, we're also providing services to those people who are living in those areas. And also, we are responding to the calls from those people and providing services and support and help for the residents who are calling the police. So right now we have been serving over 80 communities and making sure that different community and residential buildings will not allow other people to enter. And in the high-risk regions, especially in the Dalian 1 street, we have allocated over 400 police officers to conduct patrol in those areas to make sure that the lockdown can be implemented effectively. At the same time, we are responding to the requirement of the Joint Prevention and Control Mechanism. We are working together with the community and to maintain the public security, and also we are helping the residents to settle their disputes. We are working with relevant departments to provide supervision for entertainment sectors. For nucleic acid test, we are also arranging a large group of police officers to maintain the order on site. Fourth, we also provide support to maintain the order for the quarantine site and isolation sites. We are also arranging the police vehicles that are patrolling around the number 6 hospital in Dalian City. And for different communities, we also have a specialized task force, so they're ready to deal with all the emerging cases. For the epidemiological investigation, we are also working closely with the Municipal Health Commission. We will establish an effective information sharing platform. Once we found information, we will provide those information to the Health Commission in due course. We also make use of the big data and analyze all the information and to making sure that all of this information can be transparent to the public. We are working with over 200 police stations and established a dedicated team to support the epidemiological investigation. As of now, over 300 and 500 police officers has been participating in the epidemiological investigation, and we have completed the epidemiological investigation for over 2,500 people. We are focusing on 3 areas of work. First, we will provide support in the traffic control. We will take proactive actions to ensure that the daily supplies can be transported inside of Dalian City. We are setting up 4 control points in 2 highways in Dalian. We are screening out all the vehicles who have been entering into Dalian. At the same time, we are offering a green channel for the transportation. Second, we will strengthen the public security in the society in order to maintain the order in Dalian City and crack down on the illegal acts. As of now, we have found 4 epidemic-related criminal cases and over 30 epidemic-related civilian cases. We also allocate more personnel to help to deal with the emergent cases. Third, we have to ensure network security. We also have a special team to conduct 24/7 task force so that we can make sure that the rumors will not be spreaded. And right now, we have handled 6 cases in relation of the spreading of the rumors. So, dear residents, we will fulfill our duties and do our best to foster an environment that can contribute to the epidemic prevention and control in Dalian City. Thank you for your introduction. That's the end of the press conference. Thank you.